you just witnessed were actual scenes of my first year of medical school. Yes, I was very overwhelmed my first year. I had a bunch of books all over. I was doing too many things all at once, and I didn't really know what was working for me at the time. And that's kind of normal, really. In the first year as a medical student, you don't really know what works for you, and it's completely normal. You're coming from a pre med days where everybody did everything to try to get into medical school to now where you don't even have the time to do everything just because there's just so much info. So hopefully after watching this video, I'm going to help you distill down what I would do if I was your first year again, and what you I would recommend that you should do, and also to kind of just give you a little bit more comfort and knowing that it's not really about doing more. It's about having quality resources and just doing more of those quality resources. So for the first thing I want to talk about is what is important in your first year. So the most important thing that you should do in your first year is just being consistent with your studying. It's not about having all the resources. It's just about being consistent, finding a routine, and it's not necessarily finding a studying routine. It's really just starting. How are you going to start your day? Are you going to go to class? Are you not going to go to class? Because sometimes, depending on the medical school you go to, some medical schools don't even require you to go to lectures. So if you're a kind of person that prefers to go to lectures just because based on your experiences in college, then maybe you should get up early and go to class. But if you're that type of person that doesn't, you don't like lectures, you'd rather study on your own, then maybe you'll wake up a little bit later, or you might wake up at the same time, but at least have that mindset of staying at a place that's quiet, library, or if you're able to have some balance in your house, in your desk, in your house, and be able to study there. The key word is routine. So you want to make a habit of studying every day because you can't fall behind in medical school. You don't have the luxury of being able to fall behind. There's just too many content. So that was what I would recommend, is finding a routine that you're happy with. And it's going to take some time. I think knowing that it might take you a couple months, it might take you a test or two to find your groove. And that's perfectly normal. It took me a month or two to find, at least 2 months for me to be able to find a solid schedule for myself. And the second question is, should you study for your board exams early? And that's a question that a lot of medical students have. And I even had when I was a medical student, is at what time is it appropriate to study for your medical exams or your medical board exams, your step one or step two? If you're first and second year, first year you take your step one. After second year you take your step one, and then after your third year you take your step two, and then step three you take during your first year of residency. So the answer for that is you don't have to study for your board exams early. I would just focus on figuring out what works for you. Are you a lecture person? Are you an audio person? And then try to do well in class your first year. So that's my advice. Given the fact that now step exam is pass fail, I would still recommend that you study for your steps just because I think that it's going to provide you a very solid foundation for all your clinical skills and knowledge. So I'll still have the mentality of being able to do well on your board exams. And passing is no easy feat. Passing itself is a pretty big feat. So you should still consider it a very hard exam and study for that as well. Like if it's going to be a very hard exam, because it is. So I would suggest if you're doing pathology your first year, which is not very common. Actually, a lot of medical schools start with basic sciences first, like cellular, cell bio, molecular bio, I should say, and then anatomy, and then physiology, immunology. Their first year, and then the second year they move over to pharmacology, pathology, and that's where you learn most of your step like knowledge. So the best way to is to wait for your second year because that's when you'll have most of your knowledge to be able to even study for those test questions. Unless your class is combines both of them in your first year, your pharmacology and physiology, or pharmacology with pathology, I wouldn't recommend studying early. So, super long-winded answer is you don't have to unless you're taking pathology and pharmacology early in first year. The third question that I wrote down here is pitfalls to avoid. So I think, like I mentioned on the first question, you want to avoid trying to just do it all. You don't have the luxury to do it all, like I mentioned. I wish you had time, but there's just so much info thrown at you that you just have to pick one or two resources and just make sure you do it before your exam. it's gonna be a time crunch, a lot worse than you are used to in your college days. So you got to just pick a schedule that works for you, and have one or two resources that's gonna work for you. So for me, I that what I recommend, and it worked for me because I want to be able to master the material before I do questions. So I would choose a book or a very good a book that gave me all the content, whether it's lectures for you or a different textbook. I'll try to read that textbook multiple times, the chapters, depending, not every chapter, but just chapters that I had difficulty with. And then I would test myself with board questions. There's a book called Board Review, and there's board review pharmacology, board review physiology, anatomy, even, and those were very good for physiology. I remember doing very well in my cardiology block, and it was specifically because of that book. I ended up getting a really high percentile. When the average was like 70%, I ended up getting 90%, just to give you some reference of how good the book was. So it's something that I really recommend. And if you're and I think no matter if you are someone who prefers books or not, I think regardless, you're going to find some benefit from doing questions. The other advice is, the question that I get is, what is my study tips? And really, the best studying tips is kind of comes down to what your the style of learning. If you're audio, if you're visual, if you're someone who takes notes, figure that out early, and I think that's going to be the best way. But in terms of studying habits or sustainability when it comes to studying, I would say that, well, we all struggle with that, but the best method is trying to figure out like what you're going to do the next day. So writing down like, I'm going to read chapter one or chapter two, and then that night you have that in mind. For the next day, you actually start reading those chapters, and that's going to hold you accountable because you wrote it down and it's a checklist. But something that I've been using is something called Pomodoro method. It's basically where you have a set block of time, like you set yourself for 30 minutes of studying. So you do 30 minutes of studying, and that's of you dedicated studying, no distractions, and then you give yourself 10 minutes to rest. That's one Pomodoro, and it could be different intervals of that. But the goal is for you to have very focused amounts of times where you're studying. Another tip that I would recommend is trying to form a study group with it could be a small study group, or it could be a large group. But the key is for you guys to test each other with different questions, and just if you're struggling with something, someone else might have the answer, and teach something to someone. It doesn't have to be a medical student; it could be anybody in your family. If they understood it, obviously at least you understand the concepts. But to take you further, I think it's important for you to have a study group with medical students, because they understand the material as close to what you should know, at least, because they're both studying for the same exam. So those are the kind of the takeaways from kind of what I would recommend, and if I was a medical student again. But in the end, first year is very, just remember that it's a huge transition. Regardless of how great of a medical pre-med student you were, you're gonna have a hard time in medical student as a medical student. We all do, but it's not gonna be always like that. It's gonna be a transition point. It's gonna be a learning curve, and once you get over that learning curve, you'll realize that school is actually pretty enjoyable. It's a pretty enjoyable experience where you're forming friendships with a lot of people who have the same mentality as you, who want to succeed as clinicians, as doctors, as researchers, or whatever program they're in specifically. But the goal is that you guys are improving together. So remember that if you're struggling or not, we all are going to struggle at some point, and we all have to kind of hold each other accountable and help each other out. So never do it alone. When you're a medical student, never feel like you're alone. There's always going to be someone who's also struggling like you, and so reach out if you're ever struggling early, because early is always better to reach out before it's too late and you're struggling and now it's really hard for you to catch up. So I hope you guys enjoyed this video. It was a very short video, but I wanted to just give you guys some advice for those incoming medical students. I know that you guys are still interviewing, and I hope the interviews are going well. And if they're not, I hope that you guys are not too nervous to ask me questions. I could make a video about interview questions for medical school if you guys are interested. Well, until the next video, guys, have a great day. See you later.